Hello, everyone that's joining us today. Welcome to the Facebook Live event, COVID-19 and Heart Failure. First, I'd like to thank our sponsor today, Novartis, for making this program available to everyone. I'm your host, Ashley Moore Gibbs. I'm a nurse practitioner at Sanger Heart and Vascular at Atrium Health in Charlotte, North Carolina. And joining me today is Dr. Alana Morris from Emory University School of Medicine and our Women Heart Champion, Glenda Sexauer. So before we start, I just want to give a little background information about COVID-19. I think we're all very familiar with it at this point, but I think some points worth discussing is that we know it's an infectious disease, meaning that we can spread it. It's this novel coronavirus that we're going to be talking more about and hopefully giving you tips and ideas that we know here now today that we hopefully give to you as the audience to keep you safe and well and your families and friends safe and well. So primarily this virus is transmitted or spread from person to person through respiratory droplets. We also know that it can stay on objects for periods of time. And this is why we've had mandates or requests to have this social distancing or spreading apart from each other and not being close together and having gatherings and washing our hands with this hand hygiene and being very careful to avoid touching our face and also wearing masks that you've recently heard the CDC, the Center for Disease Control, come out with. And you'll probably hear all of us talk today about the importance of staying connected with important resources like the CDC that can give you guidance and the latest information. I know Dr. Morris will dip into this shortly, but it's going to be very important that we keep up with this. It's moving very fast. The information is changing literally day by day. So what you may hear today could change soon, but we wanted to give you at least some guidance, particularly for those patients suffering with heart failure. So I was going to begin, Dr. Morris, asking you a question that we had fielded earlier today about those patients that do have heart failure and what medications they should continue to take and what they should stop, if any, assuming they have no COVID symptoms, so they don't have anything that they're concerned about right now.
Yeah, thanks for that question, Ashley. So there's been very clear guidance from a number of professional societies within cardiology, including the American College of Cardiology, the American Heart Association, and the Heart Failure Society of America, making sure that patients and their physicians understand that we do not want patients to routinely stop their heart failure medicines for fear of contracting the virus. As you mentioned, I think the most important thing we know is that there's a lot we don't know. This is changing every single day. But one thing is very clear from many years of data, which is that when patients with heart disease abruptly stop their medicines, things can get worse. And so we want to make sure that patients continue their medicines as instructed by their physician. If there are any questions, they can certainly feel free to call their physician's office with specific questions. But right now, we are encouraging patients to continue taking their normal medicines as prescribed.
Very good.
If they're not having symptoms.
So if they did develop COVID symptoms, would you say, and they actually tested positive for COVID, should they stop things like these ACE inhibitors that you hear about in the news or the angiotensin receptor blockers? Should they be stopping these or what should they do?
So no, we're not advising for people to routinely stop their medicines. But again, this is an area where we would want patients to get guidance from their primary physicians, from their cardiologists, because these symptoms can become very complex and very severe quickly. So I'll give you an example. We do know that some patients who have COVID develop actually abdominal symptoms, GI symptoms out of proportion to anything else. So if a patient were having severe diarrhea, if they had lost their sense of taste and smell such that they were unable to drink, unable to keep food down, unable to eat, and they were on high doses of diuretics, that might be a situation in which their doctor would say, I want you to hold your diuretics for a few days so that you don't get dehydrated while your body's having fevers and you're having diarrhea and you're unable to eat and keep up with the outputs. But again, those are decisions that we would make on a case-by-case basis. It's very difficult to give blanket recommendations. So if a patient does have a positive test and is very symptomatic, we absolutely encourage patients to either call their doctor or to present to the emergency room if they're having a lot of trouble managing both the symptoms of their COVID as well as their pre-existing conditions that require lots of medicines.
That's great information. So along those lines, Dr. Morris, can you just clarify? I know there's some confusion with some folks about serious heart disease, including heart failure, at a greater risk of contracting or getting COVID itself, and becoming ill. Will they become more ill if they get the COVID virus? Could you speak to that?
Yeah, so I'll start with the idea of whether or not patients with heart disease have a higher risk of contracting the virus. I don't know if we know the answer to that right now. And the reason for that is most of the data that we have related to cases are based on people who develop symptoms and present to either a primary care physician or an emergency room. We don't have widespread testing of asymptomatic people, as you know. So the positive cases that we're seeing at this point are kind of the tip of the iceberg. But there's probably way more people out there who, if you tested them, they might have a positive test, but they're asymptomatic. They're never coming to medical attention. The reason why it may seem as though people with pre-existing conditions are more likely to get the disease is because they're more likely to get very sick if they get the disease. They're the ones who are showing up at their doctor's office or the emergency rooms because they're having symptoms. And we certainly know this virus does some things that are very fascinating and very scary. It causes very severe shortness of breath, what we call an acute respiratory distress syndrome, where the lungs will sort of fill up with fluid, for lack of a better word, and patients can go into respiratory distress or respiratory failure very, very quickly. Anytime anyone has any sort of infection, the heart has to work harder to pump blood to the organs in the setting of a fever to kind of meet the increased metabolic demands of the body. And it seems like when this virus gets going, it really does raise the metabolic demands of the body. And so if people have pre-existing heart disease, pre-existing heart failure, their heart may not be able to keep up with those increased demands as well as someone who doesn't have any pre-existing conditions. And we've all seen that even young people who don't have any pre-existing conditions are still getting very sick from this disease, and unfortunately sometimes passing away. The other thing we're starting to understand is not only the respiratory symptoms, but the virus seems to also attack the heart itself in a way that, again, the information is starting to evolve. The virus is probably attaching to the heart cells themselves, causing direct damage, as well as the inflammatory response. The immune system, as it tries to respond to the virus, can cause some damage in the heart. We know that some patients are showing up with symptoms that look very much like a heart attack. Their EKGs look like a heart attack. They're sort of having acute chest pain, but it's not the same type of syndrome that we see when someone has like a plaque rupture from cholesterol. So there's a lot of things about this virus that we're still learning that are very intriguing. We're encouraging people, if you are having severe symptoms, severe shortness of breath, chest pain, please do not sit at home. Please call your physician. Please call 911. Please come to an emergency room so that you can be evaluated.
And that's a great segue into another question that we received earlier. I'll go back to one about clinical appointments shortly. We've gotten a couple. One of the questions was, if I have symptoms that seem like chest pain or stroke symptoms, but I'm not sure because maybe I was exposed to someone that had COVID, if I think there's something wrong, should I be going to an emergency room or an urgent care area, somewhere where there's a higher level of care? And the answer is absolutely yes. 911 should be called. The American College of Cardiology yesterday came out with some information that they were worried that it was going to be another social health crisis, a public health crisis, excuse me, because people were delaying to come for heart attacks and strokes because they're worried they may get COVID when they go to the emergency department. Mm-hmm. I think what we need to share with the public, and I know Dr. Morris is definitely going to echo this, that the emergency departments, healthcare facilities and systems throughout the country are making every effort possible to keep people separated so that the people that could possibly have COVID are not going to be exposed to other people that do have COVID. We're being very careful to give the right care to the right person, not get people contaminated, because we have to keep up with people are still having heart attacks and strokes, unfortunately. And but we are making efforts.
We are, and we are doing our best. This is constantly evolving, as you mentioned. So I agree 100%. If anyone is having symptoms that are acutely concerning for a heart attack or a stroke, you need to call 911 immediately. You need to come to an emergency room immediately. We don't want people to delay seeking care for anything that could be indicative of an acute emergency. We do have patients, for instance, in our heart failure clinic at Emory who we cannot wait to see them until July or August when this is all over, whatever that may look like. And so depending upon your healthcare system, there may be a way to see a physician if it seems as though your symptoms maybe aren't so severe that we need to send you straight to the emergency room, but certainly may be such that we can't wait and push your visit out for 3 or 4 or 5 months. And again, that's a reason to call your physician's office to talk with them about whether or not you can be seen in a clinic space. There are some healthcare systems, including our own at Emory, where we have our main ER that primarily is seeing COVID patients, but then we have sort of separate, completely different areas of the emergency room that are kind of for subacute heart symptoms, if you will, so that our heart patients hopefully don't have to go over to the COVID side of the emergency room, for lack of a better word, for any reason other than that they're having COVID symptoms. And then many of us are switching to a telemedicine type of system where we're seeing patients by video chat, FaceTime, Zoom, all sorts of different applications that are available to us now so that we can at least connect and provide some degree of care for patients so that they're not just, out in the middle of the ocean for weeks or months at a time. So please, 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 if there's an acute emergency, call 911. If it's something that you're not sure whether or not it can wait, call your physician's office, and we are here to help our patients, but we do not want people to sit at home sick for hours or days or weeks.
Correct. Yeah. Glenda, I wanted to ask you a question when we're talking about all of this that's rapidly changing, very scary. How has it for you? How has it changed what you're doing and your health and your wellness during this time? And are you still connected with your healthcare team? Have you need to call them, or when is your next appointment with them?
Mm-hmm. So when it all started, I could see that, I was anxious and starting to eat a lot and not sleeping. So, and then my gym shut down and I thought, I can't just sit here. So I decided that, I need to stay healthy in case I would get this virus. So I've still been doing my daily workouts. I've been diligent about that. I'm lucky my gym offers a YouTube class every day. And then we do a Zoom yoga class, but there are a lot of classes available online, so that don't require equipment. So, even if it's just walking outside, do something to keep your exercise level up. And it's really just about that, keeping your health good. So I've been following my a really healthy diet, staying low salt and low fat. And I've been not having any alcohol because, I could see that too right away, that, you're at home a lot and you're anxious, and, people were saying that they're, doing a lot of drinking. So I kind of decided I better just stay away from that because that could be a bad habit. And then, I still been making sure I get a full night's sleep. I kind of try to keep my normal routine, well, normal as possible, but I have a routine, let's say that. And finally, our weather's been getting nice, so I try to get outside. And I have a couple motivational speakers that I follow, and I just started actually a 21-day meditation challenge. So it's just about kind of self-care and staying healthy.
I think you did. I think that's so important because what's happened for all of us is we don't have a routine anymore, and a lot of folks are creatures of habit, and we know we like to predict what's going to happen, and it makes us have more control of the day, and now we don't have a lot of control. So I think, Glenda, you really touched on something important in that the fundamentals are the sleep, the eating, the exercise. It's the foundational things that keep us healthy. I think that we overlook it because it's so simple, but it's those things that we actually can control. And until we can figure more of this out, it is also another way we can keep ourselves safer and healthier. So the meditation tip is very interesting to me, and I'm glad you mentioned that. I think other people will be glad about that as well. What about your medical follow-up appointments? You probably have you needed to connect with your
Luckily, I did have an appointment with an endocrinologist, not my cardiologist, and I have moved that out, although it's the end of May, so I may have to move it out again unless he's doing tele appointments, which I definitely could do with him. My cardiologist and like even my electrophysiologist, I don't have an appointment till July, so that's worked out. I actually did have in February, about the middle of February, I had did have to go to urgent care right before all this kind of started, and they diagnosed it as bronchitis. I do a lot of times let my cardiologist know when I have things. Just I don't know why. I just feel like I want them to know just in case. So I did call my nurse practitioner at that time, but like I said, that was where I am. That was before this really had started. So they were just, giving me my normal advice of like having pneumonia or anything else.
That's good. So I think another point that you bring up is the virtual health. It's a piece of care that's come into play now. We're going to see it more and more. And I think Dr. Morris will probably agree that we'll see it even after COVID, when we get to the normal or new normal, that we may be able to talk to people by phone instead of seeing them in person or seeing them virtually, the way we're doing this Facebook Live event. But there will be other times that we need to see people in person. And triaging or determining what kind of care people need will be interesting to see what happens with healthcare moving forward. And kind of towards that, Doctor, I wanted to ask you a question that had just came in about social isolating. And this is a big question, particularly for those with heart failure. Does this mean that they shouldn't be going to the grocery store, and that they shouldn't be with their grandchildren, and that they shouldn't be walking outside? What does this social isolation mean for folks with heart failure?
Yeah, I mean, this is a challenge because some of it depends on your particular situation and what resources you have available to you. I have been having conversations like that with patients all day because, there's the balance between all of us trying to keep our spirits up and trying to keep our emotional tanks full. For many people, grandchildren and their loved ones are part of the way that they keep their tank full emotionally during a time of uncertainty like this. On the other hand, I think that one of the challenges with getting a control of this virus is the realization that it spreads so easily from person to person, and people are carrying the virus when they don't have symptoms. So many of us, I think, initially were under the impression, as we are with viruses like influenza, which causes the flu, or other viruses that cause the common cold, that you'll see people with a runny nose or a fever, or they're coughing, and those are the people that you should stay away from. But in fact, we know this thing can spread through people without them having any symptoms at all. And so it's really possible to look at someone and kind of determine that that's someone that I should stay away from. The other thing that's really fascinating about this virus is, yes, it can survive, as you mentioned, on surfaces. So it could be that going to the grocery store and pushing something as simple as pushing a cart could expose you to the virus if someone who previously been pushing that same cart, if it wasn't wiped down or cleaned thoroughly, that you could pick up the virus that way. So we all have to be creative right now. We all have to make some sacrifices. Things like food delivery, grocery delivery is an option. If you are a senior, if you have pre-existing health conditions, taking advantage of grocery stores that have those senior hours in the beginning of the day where hopefully all of the equipment has been fully wiped down and cleaned. I am wearing a mask when I go to the grocery store every single time. If I can, I'm wearing gloves. If you're able to get your hands on gloves, I know that PPE is very difficult to come by, but even something like a bandana or a scarf tied around your face, as the CDC website encourages us to do, can take the place of a mask if you don't have access to one. But if you have the luxury of a neighbor or a sibling or a child or someone who might be able to go to the grocery store for you, that's an option as well. And if you have the ability to take advantage of those types of things, I would, just because there's so much uncertainty right now. And it seems like there's so many opportunities for exposure, things that we wouldn't normally think of. So,
yeah, that's so true. Glenda, I wanted to ask you a question. How has it felt for you, and how have you reacted to being in this high-risk group of people for COVID, and given that you're living with heart failure?
So I will, at the beginning, I'll admit I didn't feel overly concerned. I felt more like it was, a little embarrassed to say, but kind of just, this is an inconvenience. And I felt, well, as long as I'm cautious, and follow the guidelines, that if I stayed healthy, I could fight this, like if I get the flu or pneumonia. But then I will admit, when I saw it was causing, like Dr. Morris was mentioning, heart, problems, and understood that, your heart, if it's already weakened, you may not be able, to pump hard enough to keep going. So I became a lot more diligent to be healthy and follow the guidelines after that.
Very good. Very good. So another question has come in when people who have heart failure, who are essential workers or need to support their family, and they may be struggling, so they need to go to work each day. Can you provide any guidance, Dr. Morris, as far as how to stay safe and healthy? I know that's a very individualized question depending on the role they have, but maybe some tips that come to mind.
Sure. I mean, I think the first thing is to talk to your employer. Many of your supervisors or employers may not realize that you have a pre-existing condition. And so talking with them as honestly and upfront as you can, and expressing your concerns. If there is a way to convert to a working from home or a telework sort of model, that certainly is the safest. But if that's not possible, perhaps if they could switch your shift to a time where you don't have as much exposure to other coworkers, certainly wearing a mask and or gloves at work to try to protect yourself as much as possible. And then it's hard for all of us, but trying to remember as much as you can to wash your hands throughout the day. Remember that 20-second interval, hot water, trying to be as thorough with hygiene as possible are some of the other ways to keep yourself safe. But again, I would encourage people to talk to their supervisors as much as they can to see if there are ways to adjust their work responsibilities during this time to limit their exposure as much as possible.
Mm-hmm. Another question just came across it, and it reads, what are the top 3 challenges to expanding telehealth? I have my ideas as a provider. I think it is institutional or healthcare related as far as the healthcare system and being able to establish those platforms, because there are different types of virtual care. There is the video virtual care, which we're experiencing video live right now, but then there's also just telehealth where you can connect by telephone. So what are the top 3 challenges? I'll let you start with that, Dr. Morris.
I'll say, because I've been doing that all day today. It is it's interesting to not be able to physically examine a patient. I think there are certain areas of medicine where the physical exam, the ability to touch your patient, the ability to look for fluid in my field is key. It's critical. And as good as our resolution is sometimes on FaceTime and these other video technologies, there's probably nothing that can substitute for me being able to examine a patient fully, to put my stethoscope on the chest. I'm not sure that I can ever replace the art of the exam. That may not be as necessary for other fields of medicine, where the communication and the counseling is maybe just as important, if not more important, perhaps, than the physical exam. So that's probably one of the biggest challenges, is making sure that the telehealth model is appropriate to the type of care that needs to be delivered. We also are seeing some challenges related to the way that states sort of have their own payment systems, and many of our patients come from surrounding states, but that may present challenges for patients to be able to cross state lines and see a provider via a telehealth model. So I think a lot of these things are being worked out. I think they will be worked out. They're going to have to be worked out. But again, this is something that is evolving.
Yeah, I agree with that. One thing I'll share with you, Glenda, should you have another office or telehealth visit with your provider, I think what's very helpful, what we should be sharing as healthcare providers with our patients is think about the things we'll be asking of you. If you're able to take a blood pressure, your heart rate, a weight, your weight trends, and what are the things you want to know from us? Write those down, because sometimes when we start talking to patients, we'll have our own plan of care. So one thing I found myself doing is when I introduce myself and tell them we're going to have a healthcare visit by phone today, I tell them these are the 3 things I'm going to discuss with you today. Please make a note of what you want me to make, because I may not even talk about what you want to talk about that day. Yeah. You know, when there is that, if you don't have virtual too, if you're just doing it by phone, you may, there's that, you lose something in translation, so to speak. And so that, is there anything on our end, Glenda, that would come to mind as being if you were talking to us as a healthcare provider, what you would want? And it's evolving. Everybody give us a little grace and time, and we'll get the hang of this, right?
Yeah, I mean, those are good points, because I've wondered about that, because I thought, well, I think about the things I do when I go and they weigh me, and, and we do talk about have I gained weight, and checking for swelling, and then, like you said, they always, do a blood pressure and so forth. So I think that's a good thing to mention to everybody, to remember to do that before you get on the call with them, because obviously they're still going to need to know those things. And then, having questions. I mean, I like that you say what you're going to talk about, because I always, as I've gotten older, I have to write down what I want to ask, because I forget otherwise to talk about it. So that's a good idea, though, because it's so different. It would be different than seeing them in person.
It's true. It's true. Time will tell, right? More to come, right? Dr. Morris, one more question. When the country opens back up, should people with heart failure stay at home? And if so, for how long?
Yeah. That's tough to answer, I think, at this time. The best projections that we have from the infectious disease experts in the country and our public health experts are that this is probably not going to just go away one day. I know there were initially some hope that once it got warm outside, that once we got to the summer, that this would kind of evaporate the way that we typically see seasonal colds and the flu. And that does not seem to be the case at this time. So I would say that once the country opens back up, that patients with heart failure, patients with pre-existing conditions and heart disease still need to be very careful. Again, many of the recommendations about wearing masks in public, about very good hand hygiene, those things I think will be, certainly the hand hygiene will be critical, a critical change in the way that we normally do things. I would say indefinitely. And until we see that this thing doesn't start to bounce back. So you've probably seen in the news that areas of China and Italy and other countries around the world that have started to lift their social distancing restrictions, some of them have seen a slight bump in the cases. And again, a lot of the increase in cases depends on how widespread we're able to do testing and actually see those positive results. And so I would encourage people with pre-existing conditions to continue to be very careful, very conservative in their actions until we get a sense of how this thing is really going to go when we start to open back up.
Yeah, great advice, great advice. And Glenda, I'm going to end with this last question with you. What advice do you have for those with heart failure who may be scared or have questions?
Yeah, I mean, obviously, be smart, stay home, and follow the CDC guidelines. But besides that, we, like you were saying, we may not be able to see people, in person, but you need to stay connected still with like your people, your support group. So that can be via FaceTime or phone or Zoom. And then womenheart.org is a really great resource. They have acted quickly because they know women, living with heart disease need support right now. And that is their duty to offer that support during this time of social distancing. So if you go to womenheart.org, you'll see under their blog section, like the last 5 blogs are about COVID-19 and heart disease. And I really highly, advise going there because they have a video presentation that the doctors at Mayo created on COVID-19 and heart disease. And then they have multiple ways to receive virtual support. They have a sister match where they match you to someone who has been, there, who has the same type of condition you do. And you are contacted via phone and email. They have Heart Sisters Online, which is a virtual peer-to-peer support group. And then they have Inspire, which is an online community, and you can get an email every day, and it's information sharing, and it's a discussion group. You can actually even create or just follow different blogs from within Inspire. So you have a lot of really good resources, and I think that just helps clear things up. Oh, they also did a 1-page that kind of summarizes some of the things we've been talking about today, things you should do, what to expect, and so forth. And it's really good. So I would suggest that.
Well, that's great information. It's been wonderful to spend this time with you guys. A lot of good conversation. I think tips for those that have listened in today. So thank you, panel, for joining me today. And once again, I want to thank Novartis for their support for this live event, and hope that you will follow Women Heart and the AHFN on the social channels, and be safe and be well, everyone.
Thank you.
Thanks.
Bye.
Bye.